Right, so you're saying a non-smoker living in a city which is filled with smog can also get lung
Correct.
cancer.
It is difficult for a lung cancer to present at an early stage because of this very reason that most of the patients they tend to attribute their cough to various other factors like exposure to dust, pollution, or some infection, or they might have changed their home environment.
That person quits, but still he or she
Yeah,
has the
so even
chance.
if you have smoked for 1 year, the risk of lung cancer is there for lifetime. Increased risk of lung cancer as compared to general population. So only lifestyle modification that is required to prevent or reduce the chances of getting lung cancer is to stay away from pollution.
And when we talk about lung cancer, we always talk about smoking.
Correct.
But is smoking really the only villain? Welcome back to Expert Touch, a podcast where we make sense of medical complexities and also help you take charge of your health. Today, we're going to talk about a disease which is also widespread but often misunderstood: lung cancer. Is it really a smoker's disease? Or are we ignoring the risk factors? Most importantly, can we catch it early? To answer these questions, we have with us Dr. Supreeth, a distinguished medical oncologist with Shankara Cancer Hospital, Bangalore. Doctor is going to take us through myths and facts and also modern treatment options around lung cancer. Welcome to the show, Doctor.
Thank you, Miss Siri. It's a pleasure to be talking about one of the commonest cancers that has been affecting the society of late, which is lung cancer. In fact, it is the commonest cancer that we see among men, both in India and all over the world. Once upon a time, it used to be head and neck cancer, which used to lead when it comes to incidence in India among men. But now, lung cancer has surpassed it, which shows how significant the problem is. Yeah.
Right. And also, nowadays people are very health conscious, but in terms of what they're eating, the plating, the protein intake. But what we do not know is what is happening inside our body.
Correct.
So, to begin with, what is lung cancer? What actually happens in our lungs?
So, cancer in general, anywhere in the body, means that there are certain cells in your body which go rogue, which means they attain their ability to multiply uninhibited, and they possess this ability to spread from the site of origin to a distant site and create havoc in the body. So, that essentially is cancer. And when it starts in lung, it is called lung cancer.
Right. And when we talk about lung cancer, we always talk about smoking.
Correct.
But is smoking really the only villain?
No, I
Yes.
don't say it is the only villain, but that is the commonest villain. But we also have other villains like air pollution, which is on the rise year after year with increasing urbanization in India, increasing industrialization, and second, occupational exposure. Obviously, certain chemicals at your site of occupation upon exposure would put you at increased risk for lung cancer. Then, most important and most ignored risk factor is passive smoking.
Right.
This is something that people don't discuss about, but not just the smokers, their family members or their friends who come to expose with the smoke are at risk for lung cancer as well. Then other risk factors like firewood that we use, or in Kannada we call it saudevale, or in common language it is firewood. So that again increases the risk of lung cancer. But in majority of the cases where there is no exposure to smoke, we don't know the reason. So it is an evolving science. So we would eventually know what exactly is the risk factor in these patients.
Right. So, you're saying a non smoker living in a city which is filled with smog can also get lung
Correct.
cancer.
The evidence has been coming up off late that it increases the risk of lung cancer. Earlier, there was this hypothesis that air pollution doesn't matter, but now, yes, it causes basically the chronic irritation in your airway. Anywhere chronic irritation, like for example, if you fall down and sustain an injury to your knee, there you have inflammation, which is swelling and redness around that area. Similarly, the same phenomenon keeps happening over a long period of time inside your lungs, that increases the risk of conversion into cancer.
So, what are the early warning signs? Because, I mean, what we see in films or what people talk about, in popular opinion, you start coughing and then you actually probably ignore because there's also so much pollution. It could
Correct.
be a seasonal dust or an allergy, but it could also be a symptom for lung cancer, right? So, but
True.
what are the early signs?
So it is difficult for a lung cancer to present at an early stage because of this very reason that most of the patients, they tend to attribute their cough to various other factors like exposure to dust, pollution, or some infection, or they might have changed their home environment, or they might have painted their house. So these are various common factors to which patients attribute their cough to and keep ignoring it. Eventually, the patients present in stage 4 or advanced stage disease. That is the reason why almost 90% of the lung cancer patients, they come in stage 4, as opposed to cancers like breast, where the woman uh, is able to notice any changes in the shape of the breast or consistency of the breast and would present to the doctor at a relatively early stage. So that is one challenge when it comes to lung cancer. True.
But also, doctor, you said, if you're exposed to certain kind of an environment, also you could get lung cancer. But it doesn't really happen immediately, right? It takes like
No.
a course of time, or how
Yes,
does it
it would
work?
usually take decades. Even smoking doesn't cause lung cancer in the immediate 2 3 months period or an year or 2 years period. So it's always a time frame of 10 to 20 years that we are looking at for the initiation of carcinogenesis, which means the origin of cancer. To convert or to present as a full blown cancer, it takes decades time.
So it's a prolonged exposure and
Correct.
prolonged use of a certain substance may
True.
actually lead to this. And, also we were talking about early warning signs, and it could also be breathlessness, right?
Yes.
Because we always attribute it to our ill health or how unfit we are and about the bad food we are eating, but that also could be a symptom.
Yeah, there are other associated symptoms. Cough is one of the commonest symptoms, but breathlessness on exertion is what we call in our medical terms. But in simple terms, breathlessness on physical activity like walking or taking stairs. Uh, that is again one of the commonest presenting features of lung cancer. Other features are coughing up of the blood, which is hemoptysis, which is what is shown classically in movies, and weight loss is another symptom. And not just these are the symptoms pertaining to the presence of disease inside the lungs. Once the disease spreads to other sites, for example, the commonest site of spread is to bones in the back vertebral column. So when that happens, there will be pain in the back, which keeps increasing over a period of time. If it goes to liver, there may be loss of appetite, vomiting sensation. You don't feel like eating anything. That's how you develop weight loss also. And if it goes to brain, that again is one of the commonest sites of metastasis for lung cancer. You may have seizures, which means fits. You may have headache, you may have weakness of one part of the body, depending on which area of the brain is involved by cancer. So it's not just cough or breathlessness. These are variety of symptoms depending on the area of involvement by the cancer.
So actually, if people are aware, you don't really have to wait to till you go to the doctor and understand what's happening to you. You can actually detect it early if you can closely follow what's happening with your body.
Yes, but again, as I said, the challenge when it comes to lung cancer is a lot of risk factors, especially smoking, which is the commonest risk factor, also causes a condition called chronic obstructive pulmonary disease or COPD or emphysema, which you would commonly see in the ads in before the movies are played in India. So this emphysema also causes chronic cough, breathlessness on exertion, intermittent worsening of cough, or rarely it can even cause coughing up of blood. So, if you see, the symptomatology is very similar to lung cancer. So, smokers, they tend to ignore these, thinking that this has been the case since many years, so it's not much of a big deal, would be the attitude carried by the smokers. But unfortunately, once it goes to severe level of symptoms, only then they present to the doctor, and then investigation happens, and that's how we diagnose lung cancer in them.
Let's say a person has been smoking for, like, say, 10 years or 15 years, and then that person quits, but still he or she
Yeah,
has the
so even
chance.
if you have smoked for 1 year, the risk of lung cancer is there for lifetime, increased risk of lung cancer as compared to general population.
Oh, okay. Also, we know something as small cell lung cancer and
Yeah, so
non-small cell, right?
there are two broad types of lung cancer, or you can say three broad types. Uh, Non-small cell lung cancer, which used to be the broad term once upon a time when there were not many treatment options for lung cancer, but now that again has been clearly distinctly classified into adenocarcinoma and squamous cell carcinoma, and then there is the third subtype, which is small cell lung cancer. So these are the three types of lung cancer that we see in that order of their incidence or commonality.
Right. So, but what does it mean? Like, what is the difference between these kind
So
of?
it's just the way those the cancerous cells appear under the microscope. It's a description of their of their shape and morphology under the microscope, but it carries a lot of significance because their molecular level. Molecular level means something that happens at the DNA or at the gene level. That completely is different between or among these three subtypes of lung cancer, and that decides what type of treatment option that the patient is eligible to take. So that is different. And second is prognosis. For example, if you take small cell lung cancer, it is the worst type of all three lung cancers that we have discussed now, and it carries very poor prognosis. No matter what you do, the survival rates are extremely low as compared to the other two subtypes, because if you take the other two subtypes, the research has evolved so much over the past 10-15 years. We have a lot of treatment options. We have precision medicine that has come up in a big way in these two domains of adenocarcinoma and squamous cell carcinoma. But small cell lung cancer is something that has been a tough nut to crack for researchers as well. But of late, there are certain drugs which are coming up, but it would take really many years for them to be accessible in India.
So, what is the kind of cancer that we see largely in our country?
Yeah,
What kind?
adenocarcinoma
Okay.
followed by squamous cell carcinoma, and third one is small cell lung cancer. And small
Okay.
cell lung cancer, 95 to 99% of the patients would be heavy smokers.
So, you told us who are the people actually at risk of lung cancer, but who are the people who can actually go get it screened, like a regular checkup?
Yeah. So anybody who has been a smoker for about 10 years, who has been smoking 20 cigarettes per day, which in our terms is called 10 pack years, and who is currently smoking or has quit smoking in the recent 15 years, and who is of age 50 to 85 years, and as I said, who has been actively smoking. These are the patients at higher risk for developing lung cancer. But again, certain studies said that there is benefit by doing lung cancer screening by means of CT chest, but there are certain studies which said there is no use. So that's why we don't find any clear-cut guideline that strongly suggests doing uh, lung cancer screening. Like how mammogram is for breast, it is clear that doing mammogram will definitely help you pick up breast lesions early, and you can go and get it treated as early as possible. But same doesn't hold true for lung cancer. Doing the screening may not help you identify the disease at an early stage.
Right. So, and also PET-CT is kind of a standard procedure or
No,
standard
PET
scanning
CT
that
is
is done?
something that we do to stage. Once we confirm that it is lung cancer,
Okay.
we need to find the stage. That is when we do a whole body PET CT.
Okay. You were mentioning treatment options. So, if we actually dive into that topic of what kind of treatment is actually working right now for lung cancer
So,
patients.
as I said, the treatment differs between these three types of lung cancer. And over the past, before 20 years, we only used to have chemotherapy as the only treatment option. And there was another treatment option of best supportive care, which means just treat the patient
Palliative.
symptomatically, or in other words, as you rightly said, it is palliative
Palliative
care.
care.
That also used to be a treatment option. From there, we have come a long way now in terms of research, and that brought about a lot of treatment options like targeted therapy, which essentially means that you are identifying a particular genetic mutation in the cancer, and you are targeting that. Thereby, it's like a surgical strike what you do. So you are minimizing the side effects and also increasing the precision of your strike. And second option that has come up in a big way is immunotherapy. Apart from chemotherapy is what I'm discussing now. So immunotherapy again means that it potentiates your own body's immunity, anti-cancer immunity to be specific, to fight against cancer cells. So it doesn't go and directly kill the cancer cell, but it enables your immunity to fight against cancer.
So, do you think like lifestyle changes like hitting the gym, working out, eating healthy, putting the right things in your body would actually help us get any of these cancers? Because it's also genetic, right? You don't really know what is happening or what you're going to get. You don't understand your genetics till you are.
So, only lifestyle modification that is required to prevent or reduce the chances of getting lung cancer is to stay away from pollution. If your occupation puts you at risk for exposure to carcinogens like certain chemical industries, asbestos exposure, or coal miners, so these people are at higher risk for lung cancer. So, if you feel that you have been your occupation has been taking a toll on your health, it would be better that you quit the occupation and find an alternative job. Or if you are in a highly polluted city, you have to take measures like wearing a mask when you go out, or work from home, or these are the other options.
That's really tough to do. I mean, that's why we have air purifiers, but are they foolproof? Do they really help?
I really don't have any first-hand experience of using because
Right.
because we don't live in Delhi, so so it is
I
difficult.
didn't want to name the city, but right. I mean, it's not just Delhi. I mean, you can use this or not. See, even in Mumbai, it's around 2:33, and you can hardly see the building or roads. And I was thinking it's sunny, but you can still not see anything. The air quality is so bad, and I
True.
think even
So
Bangalore is
all
getting there.
all cities have been experiencing worst air quality of late. Delhi we use in classic sense because of
Right.
the smog issues that we see in the news every winter. But yeah, as you rightly said, every city is going through this. It is our responsibility, collective responsibility to reduce, take measures to reduce air pollution. Our contribution to air pollution as much as possible. And in general, hitting the gym or modifying your diet may not reduce the risk of lung cancer specifically, but it will definitely help in reducing the risk of other cancers which are related to obesity, such as pancreatic cancer, breast cancer, ovarian cancer. Yes, these cancers can definitely be reduced by being healthy.
So, I mean, coming back to lifestyle and food, but still, if we have to keep ourselves healthy, if in any way we have to improve our lung health, what are the kind of foods that you would suggest people
No, there is
to have?
nothing specific
Okay.
in terms of diet that keeps your lungs healthy. Just stay away from smoking.
All right. Also, um, I mean, we spoke about workout, but yoga in particular, because it involves a lot of breathing, and we are taught that it actually improves lung health. Does that benefit or help
No,
in
it
any way?
doesn't benefit in terms of reducing the risk of lung cancer. But as I said, in general, your health improves. Obesity-related cancers can definitely be curtailed by yoga. There is evidence with yoga that you can reduce the recurrence of breast cancer in a patient who already has survived through breast cancer.
I mean, apart from telling people to not smoke, is there anything else that people should keep in mind to be more aware of this disease?
So anybody who has chronic cough, which by definition is a cough that persists beyond 4 weeks, has to seek medical attention. You cannot keep ignoring it because there are a whole lot of other causes which are rather more common than lung cancer itself, like chronic obstructive pulmonary disease, or a bronchial asthma, or a tuberculosis, which is common in India, which also need evaluation. So
Right.
anybody with chronic cough should not ignore their symptom. So
Right.
that they can do, they can seek early medical attention, they can get a chest x-ray done, meet a physician, and then carry forward the investigations.
And it's not just the congestion, right? Even like a dry cough could
Yes,
say
yes, yes.
something
Any
about it.
cough that persists beyond 3 to 4 weeks has to be taken seriously.
So usually what happens when we talk about lung cancer or stomach cancer, they say this is the mother of all cancers. Usually the prognosis is very bad. Not everybody can make it. But are there also success stories in terms of somebody recovered from this kind of cancer?
Yeah, so there are with all these newer treatment innovations, like especially immunotherapy and targeted therapy, we do have a lot of patients who have been surviving for years, which was something unimaginable till 15, 20 years back. So yeah, these success stories are still possible when you're talking about treating a stage 4 lung cancer patient, or as a matter of fact any cancer which is advanced in stage. Your treatment goal is to improve quality of life of the patient, prolong the life of the patient, so that if patient has certain milestones to be achieved, or has certain good things to witness in his life or her life, you can make it possible by means of these latest treatment options that we have. As I said, one of our patients with stomach cancer who is on immunotherapy has been surviving just on immunotherapy for the past 3 years. She has a stage 4 disease. Likewise, in my previous place, I had seen a patient who took immunotherapy, who also had a stage 4 lung gastric cancer or stomach cancer, survived for 3-4 years. But just with chemotherapy, once upon a time, we used to say that the survival of gastric cancer or stomach cancer is just about 1 year. So, latest treatment options have really changed the paradigm of cancer treatment. So, cancer is not all about negativity. Even if you are diagnosed with cancer, you need not be scared about it. You have to consult your doctor, find out treatment options, and let the doctor advise which treatment option suits you the best.
And also, it's an ever evolving.
True. Every year there are innovations coming up, newer treatment options coming up. So this, I feel, is one of the interesting times to be in the domain of oncology, to practice oncology with so many treatment options that are becoming available year after year. And also luckily more and more people are getting aware about insurance, importance of insurance, medical insurance, because without that it becomes very difficult for anybody to afford all these latest treatment options. Chemotherapy is still fine. Most of them are affordable, but recent treatment options that have come up are very difficult for a common man to afford. So it is very important for everybody to have a medical insurance which at least covers 50 lakhs to 1 crore rupees. Without that, the taking the treatment, recent treatments that have come up would become very difficult.
All right. Thank you so much for patiently answering all our questions, and we definitely have more insight into lung cancer. And your final words to our viewers.
So, as we know, smoking is the biggest evil that puts you at risk for not just lung cancer. It can cause cancer anywhere from your head to toe. It increases the risk of breast cancer, gastric cancer, colon cancer, which is intestinal cancer, bladder cancer. So, various cancers happen because of smoking, even head and neck cancers. So all these, in general, all smoking related cancers are very bad. They don't respond to treatment well. Even if they respond, those responses are short lasting. So we don't expect very long survivals in these patients. So the best way to prevent this problem is to stay away from smoking, even passive smoking, which is very important. And stay healthy and stay fit.
All right. Thank you so much. So today we explored symptoms, causes, facts and myths around lung cancer. If you or someone you know is at risk, please don't hesitate and meet your healthcare professional soon. Don't forget to subscribe and share this with your family and friends.